Hello there. I'm glad to have you joining me on this module where we will be continuing our review of different body systems. Most recently, as part of this course, we have talked about the blood and cardiovascular system. Remember that these were the transportation media and the transportation system, respectively. These are used to ensure that there is a constant supply of many vital substances that we need in order to live. Then we had a bit of a look of the lymphatic and immune systems. Lymphatic system was introduced to you as the complementary drainage system for the blood vasculature. And then, of course, the immune system was all about body defenses against pathogens. And we remember that there was a link between these two systems, so I have shown them grouped together. Now, on this lecture, there is once again another link between the systems that we are looking at. So our focus will be on the respiratory system, and we will look at how it relates so closely with what we have seen so far. This is of course the fact that we gain oxygen via lungs and get it transported to the different parts of the systemic circulation, blood to the blood, and then the blood carries carbon dioxide on it to the lungs where it is eliminated from the body. So there is really a whole set of complementary functions and interactions in these systems, right? So we will be focusing on the respiratory system, and this system is very important. In fact, one of the first and of those classified as essential steps that we check for in a patient. Let's have a look of this. So airways, we want to make sure that there is an open path for the air to pass into and from lungs. This is important. Then breathing, again, makes sense. We want to see the patient breathing, so we might look, listen, and feel whether this is happening. And of course, if the patient is not breathing and is non-responsive and no independent heartbeat is detected, we move our attention to maintaining circulation through making chest compressions as part of the CPR. Recently, however, the American Heart Association changed the recommended order, in most cases, of the cardiac arrest to CAB. I think that it's always a good idea to take a step backwards and move further, starting from the very basics. So we will start by considering why do we need oxygen and why do we need to get rid of carbon dioxide? Sounds like a really good fundamental question for understanding the respiratory system, doesn't it? And we go back all the way to our introductory bio course, Bio 181 or Bio 156, and the concept of cellular respiration. Remember, we got our energy from the diet in a simplest form as sugars. And then we converted that on a cell level into energy. This energy was, of course, in form of an ATP. But this process required oxygen, and as a byproduct, or waste product if you wish to be that harsh, we ended up by producing also carbon dioxide and water. So if we want to summarize, the main function of the respiratory system is to ensure sufficient oxygen supply to the body where cellular respiration will take place, and disposal of carbon dioxide, which is the waste product of cellular respiration, as we noted. There are some other functions such as sensations, say smell, and of course speech production, which we can look at later. And if you look at how the respiratory system is going to do this, we will end up noticing that there are a few different steps that must be completed. Getting air in, distributing it, collecting what needs to be put out, and removing it from the body. And to achieve this, we have all these organs. And respiratory system organs can be divided as if they belong either to the upper or lower respiratory system. This is, in my view, a little artificial cutoff, but since your textbook uses it, we will use it too. Let's review these one by one, following the path of the air in the respiratory system. And we will start with the nasal cavity. And note that the external nose is the only external portion of the respiratory system. Behind it, we will see nasal cavity. One thing that I do want to note at this point is that typically we mainly breathe through our nose. The mouth is recruited to assist usually only when the amount of air required through the nose is not enough. Think about it, yawning is typically our body's response to the low oxygen levels and an attempt to quickly get in more oxygen by recruiting the mouth to this function. So this is why yawning may seem to spread in a room. In reality, the cause is more that the room air is likely low in oxygen. Same goes for the running and when we may start to breathe through our mouth during it, to get in more air and more oxygen, and to get rid of more carbon dioxide, and doing this all quickly. So let's start our discussion by looking at the most anterior part of the nasal cavity. Yes, the nostrils. We may note these as nares as well. Interestingly, while it is commonly used also for the singular form in the medical field, the correct Latin term would be nares. One thing that you might notice is that the nostril typically has some hair right at the opening. Some may have more, some less. Why would you have it? Yes, to filter large particles from the air that we breathe in. We will also notice that the inside surfaces of the nasal cavity are lined with mucous membrane. This is an epithelial tissue type which is thinner than the skin, highly vascular, and characterized by the mucus. This is a wet, sticky lining of the nasal cavity. And it makes this space humid and traps any particles that may have escaped the filtering by the nose hair. And it is goblet cells, like the ones that we see here highlighted by arrows. These secrete this sticky mucus. Another thing to notice, especially on this microscope image, is these hair-like structures on the surface of the nasal cavity mucous membrane. These cilia sweep mucus that has caught particles and move it towards the throat. And interestingly, within the nasal mucosa, there are also a lot of nerve endings that can trigger sneezing to force these particles out of the nasal cavity. Now, that should make sense the next time you need to sneeze. The next set of structures that I want us to have a look at are the nasal conchae. These are mucosa-covered projections from the wall of the nasal cavity. They extend from the lateral walls towards the mid-space. And there are 3 of these on each side: superior, middle, and inferior conchae. So why would you have these structures which protrude from the lateral wall of the nasal cavity? And yes, first of all, this way we are able to have a larger surface area for the nasal cavity's mucous septum. so more area for the particles to get trapped. Another interesting thing is that by having these structures, we are able to break the flow of air and then again generate something called turbulence. This is the circulating flow of air in a horizontal direction, like a tornado that has been flipped on its side. So this allows as much of the air as possible to come in direct contact with the nasal mucous membrane. What other structures can we see? Well, this same picture will help us with the next one too. Nasal septum forms the mid-sagittal line separating the nasal cavity into left and right side. This structure is made of the cartilage at the anterior portions and more posteriorly by the parts of the bones from vomer and ethmoid bones. I do want to mention, however, that it would be very rare for us to find that the nasal septum is as straight and that it makes the left and right side of the nasal cavity as symmetrical as shown on these images. In most of us, nasal septum is actually fairly irregular. I think that we might be able to see an indication of this with the MRI picture here. Look at the coronal section of the nasal cavity and rest of the head. Arrows help us to spot the nasal septum. I should also mention that the floor of nasal cavity is formed by the hard and soft palate. So the hard palate is more anterior due to the bony structure inside this tissue. I have shown this with these bluish arrows on this picture. And soft palate then is seen more posteriorly with just soft tissue inside it. It is shown with gray arrows on here. And the very back, we have uvula hanging down at the back of the mouth. Final structure or set of structures that I want us to focus on this region are the paranasal sinuses. Remember from our anatomical language that a sinus was a sac or cavity within an organ or tissue, so an empty space if you wish. And paranasal sinuses are therefore cavities in the dense portion of the cranial bones near the nose region. Let's have a look at this. And these are named based on the bones of the skull where they are located. There are 4 that I want to introduce you to. Just note that to visualize their location, I provide 2 views. One from the front and one from the side. This is because they are located in such a 3-dimensional space that you need to use those together to visualize their actual locations. So the first one that we will have a look of is frontal sinus. These are located on both sides within the frontal bones of the skull. Then we have our maxillary sinus within the maxillary bones, and again on both sides. Sphenoid sinus is a single sinus within the sphenoid bone. It is further back and therefore more inside the skull. And finally, what I prefer to describe as an ethmoid labyrinth. Some call it ethmoid sinuses. Don't be surprised if you see these used interchangeably. I use the term labyrinth because really it is a network of connected smaller sinuses within the ethmoid bone. So to me, it appears more like an interconnected labyrinth. So here we have our 4 types of sinuses. I guess that we still have one important question to answer regarding these. Why do we have paranasal sinuses? And that is a good question to which we do not have a definite answer. Your textbook lists some, and I will add to that a little. mainly because a colleague of mine spent his PhD studying these sinuses and their functions. Well, the first one that we all on the field seem to agree is that they help to reduce the weight of the skull. If the skull was a solid bone instead, it would be much heavier. So these gaps help to take away some of the weight from the skull and make it easier for our muscles of the neck to carry it. Then, other one that is becoming a better accepted and considered as a fairly well agreed one as a possible explanation. It is suggested that these sinuses play a role in the voice resonance. There has been some interesting research on these, and it does have an effect to our voice. The third one, and probably a bit more controversial, it has been described that the sinuses, these empty spaces in the bony structures of the face region especially, function a little like car's front in a collision. The cars are designed so that the front does collapse, and by doing this they absorb the impact of the collision, not putting it all on the driver and passengers. So it has been hypothesized that these sinuses could play a similar role if a person were to hit the surface face first. It is up to you to decide whether you are fully convinced. And finally, more research is starting to suggest that these spaces may have a role working with the immune system. I'm still waiting to see a little more evidence, but this is an interesting hypothesis. And it gives us a nice bridge to move on to one clinical condition that I want to introduce. Sinusitis is an inflammation of paranasal sinuses. Remember, in medical terminology, itis was always an inflammation of some kind, and in this case it is an inflammation of the sinus. And we have here also a very nice CT image of the patient's left maxillary sinus being inflamed and full of material, as you can see here. I want us to return to this figure just briefly, because we can see here, as indicated by the arrows that I placed on it, an opening of the auditory meatus. So a connection from the ear to the back of the nasal cavity. So this is why sometimes your ears may get blocked during a plane climbing or descending, or even in a car if there is a significant elevation change. This is why swallowing or opening your mouth might help. It is no coincidence that back in the day they started to give mints and other hard candy for the passengers on a plane just before takeoff or landing. Idea is, of course, to get the passenger to swallow as much as possible and help them by this way avoid the blocked ears. The final thing regarding this region that we should talk about is the function of nasal cavity at large. And there are three essential things that the mucous membrane lined route for the air to enter into our respiratory system does. Let's discuss those. Firstly, the sticky mucus-lined surface works as a great way of catching any particles that may have gotten in through the hair at the nostril. So it is all about filtering the air before it gets further into the body. Secondly, there is a rich blood supply close to the surface of the lining. And remember, this was thinner lining than the skin, so this allows us to bring a lot of heat into the nasal cavity, and this heats up the air. Have you ever taken a deep breath of cold air through mouth? You might have noticed that it makes you cough. So we want the air that enters to the respiratory system to be similar warmth with the body temperature. And thirdly, continuing with our example of breathing in through mouth on a cold winter day, the air can also be very dry, which makes us cough too. So the humid and moist environment within the nasal cavity ensures that we moisten the air before it enters into the body. So those are the three essential functions of the nasal cavity. And that concludes our review of the first section of the respiratory system. I will see you in the next video where we will continue this journey.